Welcome, everyone. I'm excited to welcome you to this episode of the Sunflower Podcast, a podcast exploring all aspects of children's palliative care around the world. Sunflower Podcast is bringing curiosity, humor, and reflection to the world of palliative care. We're exploring the joys and challenges of working in this incredible field, including topics related to education, advocacy, self-care, service provision, and leadership from around the world. My name is Rachel Neufeld, and I'm thrilled to be here as a guest host for this podcast. I'm a pediatric palliative care nurse practitioner in Vancouver, Canada, working for Connect Place Children's Hospice. I had the privilege of traveling to Nepal and Bangladesh with Two Worlds Cancer collaboration this year, teaching, mentoring, and supporting the growth of children's palliative programs in South Asia. I'm joined by a palliative nurse expert at BSMMU in Dhaka, Bangladesh, Lailatul Ferdous, where we explore how she's working in palliative care and how the program here has grown. Hi, Laila. Can you please introduce yourself and the role that you have here in Bangladesh?
Thank you. I am Lailatul Ferdous, and I'm a nurse from 2010. And here in palliative care, I started working in 2012. And I just got here by chance that I got a job in the BSMMU hospital in Dhaka, and then the neurosurgery department. And someday my supervisor asked me to go in the palliative care unit. I didn't know about anything about palliative care before.
So you were asked to come join the palliative care team.
And I thought that it is pediatric. Like palliative, I didn't ever known a word about palliative care before. So it's a new thing for me and new word. And some of my colleagues have said that there are some cancer patient and you have to cautious, and some dangerous drug will be harm you and some sort of things. And some others saying that there is a pediatric unit maybe. So and I'm previously they know that I'm not interested in pediatric because I feel very anxious when I see their sufferings. So I thought that this is not a good idea for me to get enrolled in the palliative care department, whether the word is unfamiliar with me, but I have forced to come here.
So I hear that there were lots of myths around palliative care and lots of fears around maybe some of the medicines that were being used, what palliative care meant. So maybe there was a little bit of fear and apprehension about starting palliative care. I'm curious, once you came to this job, what kind of extra training did you get in palliative care?
When I come palliative care, and I find it quite interesting to work with. I didn't seen that the people in our health system are treating with the care and compassion and such like love. They know they are dying. I know all the people in the medical thing. We say you will be cured and you will be okay. Go come hospital, take medicine and take investigation and go to home. But when I come palliative care, I thought, what is this? I didn't even think of this. And there is compassion everywhere. And I found like the team member are amazing here. The doctor, nurses. I didn't find any difference between doctor, nurses, and the other workers. There's so much compassion here in the community, in the team, and for the patient also. I am very much emotional having here. And then a opportunity come here, and I did the basic certificate course in palliative care. That was a 6 weeks course, and it was here in our department. So I took this, and after that many program come. Like I took a master trainer program. It is the train for trainer program by the ILNEC group, and they are from the Singapore, and they did like 5 years program, master program, and doctor and nurses are involved. Sometimes they come and sometimes we submit our assignments. It is a lane program, so it helped me and many of the people here to train the other, because it is the university hospital and we have the opportunity to many people share our knowledge and what palliative care is in throughout the country, as it is not existed in the textbook also. in the medical or nursing curriculum. So we have to take the opportunity to distribute the knowledge or share the knowledge with the people here in Bangladesh. And then after that, I took some many courses like nursing leadership program and end of life illness program. And then I took last in the 2021, I did the fellowship in palliative care from IPM, Institute of Palliative Medicine, Kerala, India.
So now do you consider yourself a palliative expert?
Yeah, I think so.
Yeah. So let's maybe talk a little bit about the palliative program here at BSMMU, because one thing that you mentioned was that it's a teaching hospital. And so there's opportunity to teach palliative care to other new learners and new providers. So can you tell me a little bit about the palliative program specifically here at BSMMU and what kind of services it provides?
In the BSMMU, we opened at institute-based palliative care, and gradually we opened a home-based palliative care. We have some registered patient, and in the Dhaka city, around 20 kilometer, we go to our registered patient home and provide palliative care. And we have a 24 by 7 telephone service here, and we have daycare service. So these are the service point. And then the training program, that it is the like post graduation training institute, and doctors come and took their medical MD masters in the program. And some national collaboration is here with this BSMMU palliative care, and many doctor and nurses come here to do the courses. We run some courses like 6 weeks basic certificate course in palliative care, and introduction to palliative care courses, and palliative care assistant courses, and volunteer courses. So people can come and take some courses as they want to know.
Do you have specific courses for medical doctors and specific courses for nurses and for volunteers? Like, are they all separate programs, or are they the same program for anyone that wants to learn palliative care?
That's actually the separate program. For volunteers, there's separate program, and for community health worker, there are separate program. And for the doctor and nurses, the 6 weeks basic certificate course, that is the some sort of similar, but the dosing and drugs, that are some other courses for doctors. And for doctors, there are 5 years masters also.
Very good. How have you seen this program change in the last few years? And have you seen it benefit where some of the people that have taken the training have been able to take palliative care into other places around Bangladesh?
Yeah, it's quite amazing that we have been involving in the training program, and as a nurse I could see the difference for some people. Some doctors took the opportunity to go and start palliative care in the new place. One of my doctor colleagues started palliative care in a like non-governmental setting, and like in NGO, and another nurses from another department also come here to know about palliative care. So it's an impact that people are now in the medical science of Bangladesh. They are like interested to know, and they want to started palliative care in their setting. And this organization, as a leading organization or medical university, helps other people.
So you have become the center of excellence and the hub of the wheel, so to speak, where these people are the spokes and they're carrying their knowledge of palliative care to other settings.
And I am very fortunate to become a team member of this institute.
Tell me a little bit about what else you're doing in Bangladesh. I know that you're very involved in palliative care outside of BSMMU specifically. So tell me a little bit about some of your other projects.
In 2015, BSMMU have the another external funding to start a community-based project in the biggest slum of Dhaka city, and it is called Coral. So that we name the project is Compassionate Coral Project. Then Professor Nizamuddin Ahmed was in the chair of this department, and she took the opportunity. Then some of us, we started the Coral project. Compassionate Coral elderly people are cared in this project, and after some time the external funding has stopped, and then Palliative Care Society has taken the opportunity to running this project. And as I am in the executive board member of the Palliative Care Society of Bangladesh, me and my another colleague of the board member, Dr. Noreen, has one of them, and we are co-leading the program as a now for the project under the supervision of Professor Nizamuddin Ahmed and the other colleague also. And so there I have been monitoring the palliative care assistant and projects like progress and other things, and it is quite like in the BSMMU there's some people are coming here, but in the community we are going to the community. So that's a huge difference from two types of care we provided.
I think the way that you guys have built that compassionate care corral program is fascinating and has proven to be quite effective. Can you tell me a little bit about your PCA or your palliative care assistant training and how that came to be and how things are going now?
Yeah, palliative care assistant, actually the community health workers. We found that nurses for home visit in this developing country is quite like resource constraint, and also financially we are not in the position to afford them. So we chose them, community health worker from the community. We took them who are able to work for the community, and then the training period for 400 hours, and then some sort of nursing skills and some sort of palliative care knowledge, and then they go to the in the community and go to the home visit, and they also contact with the nurses visit also will be there, but not in the everyday. Nurses deliver their home visit twice a week or once a week, and the palliative care assistant, they do the home visit regularly, and in the supervision of nurses and physicians, they actually been to the home.
Can you tell me a little bit about the positive impact the PCAs have had in the community?
Because PCAs are doing home visit, the physical part of the patient and also the psychosocial part.
So I'm hoping you can tell me a little bit about the positive impact that the PCAs have had in the community.
PCAs are actually from the community, and they are care their own community, and it is a good impact in the community. Also, community people own them, and they are very much familiar with them, and when they care for them, they are much know about their stories also. And we are from outsiders, sometimes they don't want to accept us, but it is the different from the PCAs. The PCAs, they can accept them and share their own story. And sometimes we found that one of the night, one of our patients starving, one of our elder patients starving, and she come to the PCS house, one of our PCS house, and saying that, can you give me some rice? That I didn't take anything food for the night, and the PCS gave him. And okay, so this is the care they are giving, that they trust them, whatever they saying, they know that they are by their side, not us. And the child of the community, they are now, their dream is to be a PCA. So that's the impact. I think the people are now showing their interest, that and there are volunteer support also. PCS are organizing volunteer in the community, and that's a good thing. And they're organizing small event in the courtyard meeting, and it's a good thing for us.
What a beautiful impact, and that you have adjusted the program to meet your needs, but also within the challenges of being here in Bangladesh. Like you said, the resources are difficult to find. Can you tell me a little bit about what are some of the challenges you face as a palliative care nurse?
As a palliative care nurse working both sides in the institute and the community, I found it that the palliative care nursing is not the easy one in our country, because in the health system there is no curriculum. The nurses in the Bangladesh do not know about the palliative care, and nurses have a lot of compassion, but they don't allow to spend much time in the patient bedside, and the counseling, and they are built for nursing care. I found that when I want to come sit beside the patient in the other department, my other nurses colleagues saying that, why you keep sitting by the side of patients and do the work schedule, and we have a huge work pressure. But in the palliative care setting, it is quite important to sit beside the patient. By palliative care nurse in the country, I found that it is not gossiping with the patient, but also care nurses can provide. We have a lot of nursing shortage in our country, and sometimes in the government hospital 40 patients, one nurses, but it's quite workload for them also. They don't have actually much time, but I now advocate about the palliative care and saying that when my colleagues just took the injection, they can talk with the patient also. It's not quite difficult. Whether it is 40 patient or 30 patient, we can interact with the patient also. So it's actually we have to change the thing in the nursing in the country also.
So what I'm hearing is that you're encouraging your nursing colleagues to make
Yeah.
connection with the
Yeah.
patients, even if your time with the patient is brief because you're very busy and you have to move on. It's about making that connection with them. And that a lot of your care is also communicating with your patients.
Yeah.
Wow, what a fantastic leader you've become. Can you tell me a little bit about what you enjoy about doing palliative care and what are some of the good things about your job?
Yeah, I enjoy when people are saying me, patients are saying that they are comforting by me. Like I can provide some sort of comfort by my presence, my talk, or my work, my care. Some people say to me that they are dying, they know, but I have a big impact in their life. This is quite a lot of motivating factor for me, my patients, and that's why I'm keep going. And I advocate for my patients, and I want to like advocating around the nurses also, because when I share my stories, the other nurses also get motivated. It's a thing that when I talk, the other people other side also accepting me, it's a good thing. Then I'm thinking that okay, I'm good at my job and it's quite helpful for the people who are suffering. So I'm thinking that it is our duty to serve the people in the community. That's why when our community have much compassion and the support system, then when I am also suffering, the people will beside me also. So that's not only for the patients, I'm some sort of selfish here also, that for me also I get the same support.
That's fantastic. Do you have a memory of a particular patient or a story that you could tell about the highlight of your nursing job?
Yeah, one of my patients, a CS cervix patient in the Coral slum, she had two children. The elder one is mentally disabled, and the another one is okay. The elder one is 12 years old and smaller one is 8 years old. But she was a widow. She know that she is dying, but she has no other person beside in the community, and it was quite devastating for her. And she is thinking of what will be happen after she dying for the elder son, because she is mentally disabled. After his mom, he is nobody to take care of her. And when we support her that we are here, we are take care of your child and we will get away, don't worry. So then she cried and holding my hand and saying that is a good comforting thing we share with her. And she just nothing saying, but we can see in her eyes saying a lot of things. And I'm motivated again that I should not stop here. I should keep going to help these people. Maybe I am not enough, but my team, if we are working in a team, we can have an impact.
So she felt like you guys were a trusted group of people that she could put her son's life into your hands because she trusted you and she really appreciated your care.
Yeah.
What a great story.
And then the PC, actually the palliative care assistant, are good in their work, and they contacted with another sister of our patients, and they contacted and to come taking care of our patients. And then her elder sister came, and she is also elder, so we got involved in our project also, and we take care of her, and she now take care of the child. So now the patient has died, but elder sister and her child is our care.
Fantastic. And she could die peacefully knowing that there was actually a plan for her children.
Yeah.
That's a great story. What do you hope for in the future in terms of palliative care here in Bangladesh?
in the future, I look for training, any national guideline or making any books or anything that will have a great impact palliative care in the country, because we are providing care for a small amount of people here in Dhaka only, but in the community and remote areas there are a lot of people, and we are trying to focus on small project or planning of building an institute of palliative care in Bangladesh, and there is a strategic planning is going on and I'm a part of it. There is a palliative care society in Bangladesh and I'm an executive board member there, and I'm also involved in the Palliative Care Bangla Journal editorial board, and I'm looking forward to train more people and making manuals and making like some journals, and so people can know and feel the same way we feel and share our stories.
Spreading the knowledge.
Yeah.
And lastly, what's something new that you've learned in the past year or so?
I learned that when I'm involved in the Fellowship of Palliative Care program, it is an online-based program, and worldwide the people come together. They do the same program. And after I am completed the program, I became a mentor of the fellowship program. And from the past 2 years, I'm mentoring the participants, maybe like 10 or 12 people. I think that the learning about palliative care never ends. It's like every time I do mentoring, see that it's always ongoing. I always learn a new thing. Some other people or a people from the another country, they share their stories. I learned that palliative care is different for the every people, individual people, and maybe different for every country. Maybe in your country, palliative care format may be like another type, but in our country, we can modify it in our way.
I love that. And I agree that the learning is lifelong.
Yeah.
And we can all learn from each other. And that's part of what's so interesting and beneficial of this international palliative world that we have, where we can learn from each other and adapt our palliative programs according to what makes sense in our communities. You've done some amazing work here, and I wish you all the best as this program continues to grow.
Yeah, thank you.
Thank you for listening to this episode of the Sunflower Palliative Care Podcast. These podcasts grew from a seed of an idea as we talked with our colleagues in the Sunflower Children's Network. The Sunflower Children's Network is an initiative of Two Worlds Cancer Collaboration, which focuses on children's palliative care. We hope to build a world where no child suffers from serious health-related issues. To learn more or to donate, please visit twoworldscancer.ca.